Hello, teachers and friends. Today, Abhilash, Niranjana, Yuepin, and I will be sharing with you the issue of infertility in men and women. The order of content that we will be covering is what is needed for pregnancy? What is infertility? Why does infertility occur? Causes of infertility in men and women. So, what is needed for pregnancy to take place? First, a woman must produce and release a healthy egg from one of her ovaries. Then, a man must produce a viable sperm which can successfully fertilize the woman's egg. After the egg has been fertilized, it must travel through a fallopian tube towards the uterus. Finally, the fertilized egg must attach itself to the inside of the uterus. However, one cannot get pregnant or cause pregnancy if one is infertile. So this brings me on to the next point. So, what exactly is infertility? Infertility is defined as not being able to get pregnant despite having frequent, unprotected sex for at least a year for couples. The reason that infertility occurs can be caused by many factors such as problems with egg or the sperm production, genetic factors, age, or too much exposure to certain chemicals and toxins.
Now I'll be talking about infertility in women. For women, infertility could be due to many reasons, such as hormonal issues. When hormone disorders are present, problems with ovulation can occur. These can be due to the lack of the necessary synchronized hormonal changes, leading to the release of an egg from the ovary. Gland disorders can also cause infertility in women. These hormonal disorders may include polycystic ovarian syndrome, also known as PCOS, or problems with the hypothalamus, pituitary gland, and the adrenal gland. Structural issues too might be a reason for infertility. When the fallopian tube is damaged or blocked, often caused by inflammation of the fallopian tube, this can result from pelvic inflammatory disease, which is usually caused by a sexually transmitted infection, endometriosis or adhesions. A poor diet or overexposure to chemicals can also cause infertility. Now I'll be talking about the causes of infertility in men. For men, some causes of infertility could be abnormal sperm production or function due to undescended testicles, genetic defects, health problems such as diabetes, or infections such as chlamydia, gonorrhea, mumps, or HIV. Enlarged veins in the testes also can affect the quality of sperm. Cigarette smoking, alcohol, marijuana, anabolic steroids, and taking medications to treat bacterial infections. High blood pressure and depression can affect fertility. Frequent exposure to heat, such as saunas or hot tubs, can raise body temperature and may affect sperm production. Damage related to cancer and its treatment include radiation and chemotherapy. Treatment for cancer can impair sperm production, sometimes severely. Problems with delivering the sperm due to sexual problems such as premature ejaculation, certain genetic diseases such as cystic fibrosis, sexual problems such as the blockage in the testicle, or damage or injury to the reproductive organs can also cause infertility in men. Now I'll be passing on the time to Abhilash.
Symptoms of infertility in women can be detected in various ways. Ovulation testing. Blood test measures hormone levels to determine whether you're ovulating. Hysterosalpingography. Hysterosalpingography evaluates the condition of your uterus and fallopian tubes and looks for blockages or other problems. X-ray contrast is injected into your uterus and an X-ray is taken to determine if the cavity is normal and to see if the fluid spills out of your fallopian tubes. Ovarian reserve testing. This testing helps determine the quantity of eggs available for ovulation. This approach often begins with hormone testing early in the menstrual cycle. Other hormone testing. Other hormone tests check levels of ovulatory hormones as well as pituitary hormones that control reproductive processes. Imaging tests. Pelvic ultrasound looks for uterine or ovarian disease. Sometimes a sonohysterogram, also called a saline infusion sonogram, is used to see details inside the uterus that are not seen on a regular ultrasound. See this video on how hysterosalpingography is performed.
Blocked fallopian tubes, or an abnormal uterine cavity, may cause infertility. Hysterosalpingography, or HSG, is an X-ray test to outline the internal shape of the uterus and show whether the fallopian tubes are blocked. In HSG, a thin tube is threaded through the vagina and cervix. A substance known as contrast material is injected into the uterus. A series of X-rays or fluoroscopy follows the dye, which appears white on X-ray, as it moves into the uterus and then into the tubes. If there is an abnormality in the shape of the uterus, it will be outlined. If the tube is open, the dye gradually fills it. The dye spills into the pelvic cavity, where the body resorbs it.
Ways to detect infertility in men. Semen analysis. Your doctor may ask for one or more semen specimens. Semen is generally obtained by masturbating or interrupting intercourse and ejaculating your semen into a clean container. Lab analyzes your semen specimen. In some cases, urine may be tested for presence of sperm. Hormone testing. You may have a blood test to determine your level of testosterone and other male hormones. Genetic testing. Genetic testing may be done to determine whether there's a genetic defect causing infertility. Testicular biopsy. In select cases, a testicular biopsy may be performed to identify abnormalities contributing to infertility or to retrieve sperm for assisted reproductive techniques such as IVF. Imaging. In certain situations, imaging studies such as a brain MRI, transrectal or scrotal ultrasound, or a test of the vas deferens vasography may be performed. Other specialty testing. In rare cases, other tests to evaluate the quality of the sperm may be performed, such as evaluating a semen specimen for DNA abnormalities.
So, how to treat fertility? Fertility drugs. Usually, the first infertility treatment that couples undergo is fertility medication. When a couple first has trouble conceiving naturally, their physician will usually prescribe them fertility drugs aimed at stimulating ovulation, thickening the uterine lining, increasing sperm count, or other methods designed to increase the chances of conceiving. Talk to your reproductive endocrinologist to discover which fertility drugs might be right for your infertility options. Medical procedures for infertility. Firstly, we have vitro fertilization or IVF. Perhaps the most commonly known ART method in vitro fertilization involves the harvesting of sperm and egg cells from each partner. Then, the gametes are combined for conception in a laboratory dish. Once the embryo develops, it will be transferred into the woman's uterus for implantation. After it successfully implants, her pregnancy will likely proceed just as any other pregnancy would. Intrauterine insemination, or IUI, when the harvesting of egg is not needed. In this procedure, sperm is collected from the male partner, washed to remove seminal fluid, and then inserted directly into the uterine cavity to increase chances of conception. Intracytoplasmic sperm injection, or ICSI. This treatment is part of the IVF process, where a single sperm is inserted into a retrieved egg. It is usually used in cases of male infertility problems. Assisted hatching, to increase the chance that an IVF-created embryo will implant in a woman's uterus. Some medical professionals use the hatching technique This method makes it easier for an embryo to hatch out of certain layers of protein and then implant. Gamete intrafallopian transfer, or GIFT. Like IVF, the GIFT process harvests egg and sperm from intended parents. Instead of fertilizing the egg in a laboratory dish, however, this method mixes sperm and egg and then implants them into the fallopian tube for fertilization. Zygote intrafallopian transfer, or ZIFT. The ZIFT process is similar to the GIFT process, although the egg is fertilized before transfer to the fallopian tube. Finally, sperm, egg, or embryo donation. If the sperm or egg of an intended parent is not viable for a healthy embryo creation process, gamete donation is another way. And here are our references. Thank you and have a nice day.